So, welcome everybody to the talks today regarding COVID-19 situations. We're talking about the situation in Germany as well as in Europe. We have here Dr. Daniel Schmücking. He's our country representative of Conrad Adenauer from Cambodia. He will be here answering a question from everyone regarding our topic today. And the Q&A talk will last for an hour according to the schedules, and we will also welcome questions from everyone. You can ask questions either using the chat function in the Zoom, and also you can also raise your hand to give us a sign so that we can give you a chance to ask the questions. Okay. Just to inform everybody's here that we might also do the recordings of our discussion here, because it's just for the purpose of sharing to those who maybe they are also interested in the talk but they couldn't join, so we can use the video to share later with them. Okay. Okay, so without further delay, I'd like to start straight away to our speaker. So before taking questions from participants here, Daniel, could you tell us a little bit, first of all, where are you specifically in Germany, and how does it feel like over there?
Yeah, for me, thank you very much. I'm in Jena. Jena is a little town in Germany with around 100,000 inhabitants. It's a university city, so we have here around 25,000 students. Usually the city is very busy and people are on the street and mingling, but at the moment it's a bit quiet here. So that's more or less the situation. It's a bit strange to see this. Usually very active city, very, very calm now at the moment.
Okay, thank you so much, Daniel. And to give us to our discussion a little bit of warm up, can you actually tell us how generally is the situation there in your regions and in across Germany, yeah, regarding the outbreaks of the disease?
I mean, in general, I would say a lot of people are scared. It's a situation where we don't have a lot of experience. That means the public, the population is unexperienced, but also the government. And we still don't know an outcome of the situation. So that's what we are into. And for the time being, there are a lot of measures that the government took here. But now we have to wait and we have to be patient to see if it's effective. You know that Germany has a lot of cases in Corona cases, but we just have a very few number of dead people compared to other countries. There is a lot of speculation why it is the case. A lot of people and experts, people that know it much better than I do, think that it's because of the testing. We do a lot of testing. That's why we know a lot of cases compared to other countries, and also the health system in Germany is very, very stable and very good, and I think that helps also a lot.
Thank you. So we speak about how the government respond to the situation across Europe. So we know that many countries in Europe has placed restrictions and as well as guidelines and measures to curb the spread of virus. So for Germany specifically, what kind of specific let's say measures and restriction have been put into implementation over there, and how does it work? I mean, we know that in Germany it's a federal system, federal government. So, like for example, if a federal government have a guidelines for specific implementations of the rule, and how does it be implemented across Germany?
Yeah, completely right. Germany is a federalized state, so we have 16 states, 16 own governments in Germany who have to make their own decisions how to treat the virus and how to fight it. And at the beginning, it was a bit difficult to bring everybody on the same page. And we had some federal states who were affected more of the coronavirus, who acted more quickly than others. For the time being, the overall regulations are quite similar, because the federal government, they stepped in and they introduced some regulations that are valid for everybody. So what we have at the moment is, and this is comparable, let's say, to Cambodia, is that schools are closed, universities are closed, all, let's say, unnecessary businesses or more shops are closed. So what is open is still shops where you can buy food, like supermarkets, pharmacies, drugstores, all these important things. People are recommended to stay at home, and if they go out, that they keep distance from others, around 1.5 meters. You can imagine this is a challenging situation for a democracy, because it's a restriction of human rights if a government is saying, hey, people, you have to stay at home, because it's affecting the personal freedom of people. And at the moment, we are in a situation that these measures that I described will stay in place until so far until 19th of April. So that is the situation at the moment.
Okay.
Yeah, the government measures.
Okay. You spoke about the comparison between Cambodia and Germany. From your, from your knowledge, do you know whether the government there in Germany is specifically considering any like a stricter measures such as like law? For example, most of us here also understand that we are here in Cambodia discussing about the law on emergency. So for your questions, is the government over there planning such law or restriction like that?
No, there is, I would say at the moment, the restrictions we have in place, they are already quite strong. And there is no discussion about further measures. There is a discussion, and that is, I think, interesting when you compare it to Cambodia, is the question of how, if it's necessary to wear a mask. You know, in Cambodia, a lot of people, if they are sick, or even if they are not sick on the street, are wearing masks. We have this discussion now in Germany as well, if it should be introduced in the city I'm living in at the moment. It is the first city in Germany that will introduce mask, that you have to wear a mask if you go to a supermarket or if you go into a public transportation. And the idea is, first, the idea is not to wear medical masks, because they are really, really needed in the health sector, but to wear, let's say, self-made masks that you protect others, that the virus is not spreading from you. Because the problem with the virus is you might be infected without having symptoms, and that means you can spread the virus without even knowing that you have it. And with this mask duty, you can avoid that people are spreading the virus without knowing. This is one discussion. And the other big discussion is how to get out of this lockdown, because it's painful. It's painful for, as I mentioned, for the democracy, for the human rights, but it's also painful for businesses, the overall economy. And we are discussing now ways to get out of the lockdown. And last week, a strong discussion started in how to use smartphone applications to track the infection chains. The discussion is to do it very, very careful when it comes to data protection, because nobody wants that the government is collecting personal and private data, but still to have a to have an application that is working on a volunteer base, where you are getting the information if you have been in contact with somebody who is tested positive of corona. And I think this will come, and it will come quickly. I believe that in a few days, maybe in a few days, these application will be established, will be developed, and then it will be promoted to the public, that the public is using this application. I know that at the moment, the German military is testing this application to see how it works, to see if the algorithm is working. And it's kind of funny to see how the German military is working with their smartphones and try to I don't know, to train the algorithm of these of this application.
Okay. So speaking of the cases, Daniel, can you share us, like, do you have any information that you would like to share us regarding the specific numbers of the case over there, and how many has been tested, how many has been recovered in across Germany?
Yeah, I prepared a few slides I would like to share with you. The first slides is a bit about the numbers, the cases, and so on, and the other slides, they are more about the public opinion, how the government is handling the crisis. I think I start with the number of cases. Just a second.
Before you start, I also would like to remind all of the participants here that you can always ask questions right now, even right now, through chats, and also you can raise your hand during the discussions, so that we can make our discussion more active and to get a little bit of different perspective. Because I know some of you are from Cambodia, some of you are from Germany. I have already seen a face from Germany here. Yeah. Okay, you can start sharing your slide, Daniel.
Okay, thank you. I start now. So just a few numbers to remind you how the situation is and what we are handling. I think one thing we have to consider at the beginning is that there is no easy solution for the problem. There is no vaccine, I think, that will be developed in under 1 year. So I think we have to be patient, and we have to find other ways to avoid that the virus is spreading. So the numbers. So this is data from, I don't know, 1 hour ago. I just made this. Let's see. So we have now over 100,000 cases. That is the overall cases. Out of these, 28,000 have already recovered. So they are already healthy again. We have around 1,500 deaths. I will show you later that this is a very, very low number when you compare it to the cases and if you compare it to other countries. So here's the situation at the moment. You see on the right side the closed cases. From the closed cases, around 5% of the people died. And from the currently active cases, just 6% are in a serious or critical conditions. The other ones are in a mild condition. What we at the moment don't really know is what is the real number of infected people. Scientists say that it could be 10 times higher than we know, which would mean when we talk about let's say 100,000 cases in Germany, the people really infected might go up to 1 million, which means that, that this is important, because when you want to avoid spreading the virus, people who had the virus and are healthy again, they are now immune and they cannot spread the virus again. So if this number is very, very high, this could be very good news, because then the wave going through this might be stopped earlier than we expect. Here, that is also a very important number, is the daily new cases. Because the problem of coronavirus is that on average, one infected people can spread the virus to 2 or up to 5 people. And you can imagine when you have one infected person and he infects 5 people, and those 5 people infect each another 5 people, then it will spread very, very fast. So the measures of the government at the moment is to get the number of the daily new cases down. And what you see here, the last column is from yesterday, and you see this effect. We have less daily new cases, and that is good news because this big wave, this exponential function, what the scientists say is it's going down, and the measures the German government is taking, they are really working, which will lead to the situation that when you look at the active cases, um, um, it's not going up so fast anymore. More people recover than are getting really infected, and yeah, that is very good news. Here, I think it's my last slide about the cases. You see, this is an overview of the countries that are mostly affected by the virus. You see now #1 spot is the US. And here in Germany, you have 100,000 cases and just 1,500 deaths. And when you compare to other countries, even countries like France, who have less cases than Germany, but much more people died. I think the main reason for this is that that Germany did way more testing.
Okay. That is the last slide, Daniel.
That's the last slide, yes.
Okay, thank you so much. You pretty much wrap up the situation here in Germany. We're starting to getting some question already, and I saw first Mr. Bonna one. He wanted to ask question by raising hand. So please, Bonna, you can ask your question. But first, you can unmute yourself so that we can hear you.
Okay.
Okay.
I am Bonna.
Yeah. Okay.
I am a Cambodian student studying in New Delhi in India now. I want to ask a question that what are the common response of the European Union in order to fight or to counter the coronavirus in the Europe in general? This is the question.
Okay. Thank you.
So it's a European approach. The question goes to this. Yeah. Okay. I try to speak a bit about the European Union is handling the crisis. What we observed in the last weeks, and we are in a situation that is going really fast. And the first thing the member states of the European Union did is to act by themselves. So there was not a lot of coordination in the European Union. Each member state took own measures. We unfortunately also have seen some border closings in Europe, and even in Germany, some federal states are now controlling their borders. And when that is, let's say, making me a bit disappointed, because the high value of Europe is that Europe is a continent without borders, that you can travel freely. And this, at the moment, is not the case anymore. Now, I think that the situation is calming a bit down. There are more coordinated approaches with Brussels, with the European Union. But let's see how this goes. At the moment, it's difficult to predict. So many things have going so fast that I would say that we don't really know how the situation ends. I'm hopeful that Europe is coming to an European approach, because at the end, this is a global crisis, and I'm quite sure you cannot solve this in the member states. I think Europe has to work together to find solutions for this. And also what I talked about, the application that is developed at the moment, the main idea is to also use it in whole Europe and not just in Germany. Bomei, you have to unmute yourself. You're mute.
Sorry. Okay. So thank you so much for the answer, Dr. Schmücking. And we have now the second question from our participants. Sina, would you like to quickly introduce yourself and then directly ask the question so that we can know where you are right now or something?
Okay, my name is Sina. I'm currently in Germany, Leipzig, and yes, I also a master's student here. And currently, the situation in Leipzig also similar to what Daniel has said in Jena, and my class have been suspended until further ado. We don't know yet until which day. So basically, I have one question, like as like Daniel had said that in Jena, people start to like using masks, wearing masks when they're like going to the market and so on. And basically, for me, like I try to find masks and buying masks in the market for almost a month now, but it's impossible to find a mask. And I will just a scarf to cover my face and so on. So I wonder whether the government will be like provide a free mask in the future, like in Singapore, that they are doing. That's it.
Okay. Thank you for the question.
I would not be so optimistic about that the government is providing the mask, because I think the government is at the moment very, very busy in getting the equipment in the health sector and the masks in the health sector. Germany is preparing the hospitals for the virus, and you know that for those cases who are in a serious condition or in a critical condition, they need intensive care beds in the hospital, and they need ventilators. And the German government, they already more or less doubled the number of intensive care beds in Germany. I think we now reached a number of over 40,000. The masks for the normal population, there are a lot of recommendations to find easygoing solutions, to wear a scarf, to wear face masks used for hiking, skiing, and things like this, because this is not medical equipment. It's more that you don't breathe so far, and that when you are coughing, that the virus is not spreading so far. So what I did, I went to a local shop here in Jena, and they sold me handmade masks, and that was easy. It was easy going. You can reuse them, and yeah, that's my recommendation for you who are in Germany. But I don't think that the government will provide the masks. No.
Okay. Thank you, Daniel, for the answers. It's also interesting to discuss about the mask because as we have seen nowadays, firstly, WHO actually trying to discourage people who are healthy to wear masks because they are quite concerned over the shortage of masks for those who need it the most, for example, like medical worker, those who work in the health sector or something. So yeah, it also could be interesting to ask about this kind of debate. Okay, we have a question from Chia Visna. I also asked him whether he wants to address it personally to you or not, but yeah, I think I will just ask you straight away. His question is, has the government of Germany declared a state of emergency yet? In the last few days, the numbers of deaths, in Germany has increased. So it's a question about the state of emergency. I think we talked about it previously.
There is no state of emergency, and there the government is really, really careful in what they are doing, because they are well aware that they are at the moment regulating the personal freedoms of the population. And still at the moment, I can share later in some slides, the overall public opinion about these measures is very positive still. But you can imagine if a government in a democratic country says you have to stay home and you reduce your personal freedom, that not many people are liking this. So what I see at the moment is there will not be a state of emergency. And I don't think that is also the right way, because at the end, for what do you need a state of emergency? At the end, you need good hospitals. You need to make sure that your economy is not declining. Those are the most important things, and not special laws on giving more power to the government. The government is already quite powerful. So that's what I think about it.
Okay. Before we're taking another question from our participant, just a little bit of follow-up question is from my side. So you're saying Germany will not implement such law. So are you saying that like in Germany, there's already have been a law existing there? Because if we compare to Cambodia, we are still like working on the drafting of the law. How is it different there?
To be really, I'm not a lawyer.
Oh yeah.
I have to check. I don't know it by heart if Germany has a state of emergency law, but I think we don't have it. But I'm not sure. I cannot say. I cannot really answer this. But there's definitely no discussion about it. It's more this approach. The government is more using the strategy that they have to convince the own the own population that it's necessary. And it will be the same with this application I talked about. This application, the government will ask the population if they might use it, because for the overall good, but the government will not force the people to use it. So they still believe that with information and with the right measures and with a lot of trust from the population to the government, those kind of things are not necessary.
Okay, thank you so much, Daniel. So, okay, so I'd like to remind once again for those who have just joined us here, you can always ask questions by raising hand and also through chats during the discussions. And those who have already asked, they can also ask again. It's a free discussion here. So we're taking question from Wichika Serai. Wichika, you can unmute yourself and ask question.
Hello, Dr. Daniel. I'm Vijika, I'm sure. I don't need to introduce myself. My question is that I've heard you mention about democracy at the beginning. So for now, the people seem to be very cooperative and understanding of the strict measures. But if this prolongs, do you think in the future, or in the next months, if the cases are not declining, do you think democracy and the strict measures might clash? Because here in Cambodia, we've always been restricted, so we're kind of used to it. But in Europe, the Europeans, they can exercise their freedom openly. But when it's strict measure like this, and if it's prolonging, so will they clash at some point?
Yeah, thank you. Thank you very much. It's a very good question. And I think, yes, it will, because so far the government explained everything very, very carefully and very good to the population, from my perspective at least. There's a lot of communication. So communication from the government, first of all. Then there is a lot of communication from virologists, so the specialists, the specialized doctors on this topic. So I think the population is very, very aware of the dangers and of why it was necessary in all this. But we are coming now into a situation that the number of cases are going down, and people will start to ask the question, is it really still necessary? And is everything we have in place necessary? And I strongly believe that there has to be a shift, that there has to be a change in the next weeks, because people will not accept this for much longer. I can give you some examples because I went to Germany last weekend, I think last Saturday. So I'm here now for almost 8 days or something like this. And for me, it was super strange to see my own country like this. And here's so many examples where I think they are strange and they are not necessary. So people are overreacting. The government is overreacting sometimes. And there needs to be a very, very balanced approach to really look into what is necessary and what is not necessary. My example is that we have very beautiful weather at the moment. Spring is coming to Germany and all the playgrounds in the city are closed. So the kids cannot play on the playgrounds. And I think this is it's a strange situation. And I really, really hope that this will not last longer. And yes, I think we have to be careful because otherwise it will clash. And we have to find better ways than to let people stay at home is the only excuse. So I don't think that is a good situation.
Okay. Thank you, Daniel. We have another question from May. May, you can go ahead and ask question to the speaker.
Okay, thank you for giving me the chance to ask question, and thank you, Dr. Daniel, for hosting this discussion. I have a question regarding the economy, like how is coronavirus affect the economy of Germany, and how will it affect, the Germany's economy? This is my question, but I also have an opinion regarding state of emergency. As a state of emergency, maybe we talk about the big scale of how a government, control the situation. But how about the lockdown in Germany? Because since, case has been increasing in Germany, how will the government control that? I'm talking about the lockdown, not the state of emergency as a whole, because it's too big.
Okay, so in total, you have two questions. What is the government strategy? I mean, considering the lockdown, if the case is still increasing. And the other one, which is the first one, is
the economy, how the coronavirus affect the Germany's economy.
Okay, thank you so much. Daniel, please.
I will start with economy, and I have to look a bit in my notes because yes, the impact on the economy will be big. There is, in Germany, we have an economic advisory panel to the government. Those are, I think, a few professors specialized on economy, and they give recommendations to the government, and they also do predictions, and they updated their prediction for this year when it comes to the economic growth. And they have two scenarios. In their best case scenario, they say that, that there will be a decline of 2.8% of the German economy. In their worst case scenario, they predict a recession of 5.4%. So what almost for sure will happen is that Germany will go into a recession this year. And the law depends on how long this lockdown will last. The government put a lot of money in supporting businesses. They introduced a very big rescue package with, I don't know, billions, hundreds, thousands of billions of dollars to provide grants and loans for affected businesses. And it went really, really fast. So when your business is affected by the corona crisis, you could apply for a grant, and this went very, very fast to the bank accounts of the businesses. Overall, you know, Germany is a social state, so we have a very high social protection system. That means even if you lose your job, for the workers, you still get some payment, and you have still health insurance, you still have some payments every month. So overall, even if you get fired because of the crisis, you are socially protected, and I think that's very important. Again, how to hold the lockdown, that was the second question. Yeah, I don't think it will last longer. And I don't think that we will have some kind of emergency law, because now even this, it is still very flexible. I mean, there's a lot of information, and some things are closed, but you don't have to stay home the whole time. You can go out, you can go hiking, you can walk in the park, you can go to supermarkets. This is still all possible. And I don't think this will change. I don't think that we will see lockdowns like in Italy.
Okay, thank you so much, Danny. So before taking more question, we'd like to inform everybody here that we have less than half an hour here to ask question, because according to our schedule, we will ending the discussion by 6. So please drop your questions when you have any doubt, and also raise your hand. Okay. Another question from Visna again. He wants to know regarding the human rights situation in terms of coronavirus outbreak. Do you think that it will affect those who advocate for human rights because of the restriction and so on? And yeah, you can firstly answer this, because he has a following up question, but you can answer this first.
No, I mean, the problem is, those who advocate for human rights, they are not affected here in Germany. I don't see that. It might be different in Cambodia when we discuss about the fake news laws and everything what is in this state of emergency law. I think we have to really, really be careful with this, and we have to closely observe what will happen when this law is implemented. But here in Germany, it's more a situation that the state, the government, is at the moment limiting or restricting the human rights. So at the moment, because of the corona prevention, people lost their right of freedom of movement, because they cannot move freely anymore because of this lockdown and the measures. People cannot demonstrate anymore on the streets, because they might be so close, and it might be dangerous for demonstrations. So this is a limitation of the rights. And that's what I mean more. It's not that human rights activists are in danger here. That's that's not the point. But for a limited time, the German government is restricting the human rights. That's what we see at the moment.
Okay. Yeah, I think Daniel already answered his following up question, because he asked how to handle human rights in times of coronavirus. Okay, so I'd like to move to more questions. So from Siner, he wants to know that did the government in Germany put any actions so far to SME and self-employed and also student to curb the outbreak?
Students, probably not. Very sorry, I don't think. But yes, for self-employed, that's what I mentioned before, these grants and the loans for self-employed people, for SMEs. I talked to some of my friends. They have a small enterprise here in the city of Jena, and they told me they applied for this grant, and they got it very, very quick. So I think this is working fine. And so a grant means that is money you don't have to pay back. So it's your money. You can keep it, even to pay salaries and rent and all this what is going on at the moment. Yeah.
So I mean, Daniel, it's from my perspective. So no measure at all to school, to students over there in Germany.
No, I mean, no financial support, no, because I mean, students usually don't get a salary. So anyway, that's, I mean, the universities are closed, and I don't know what will happen in the future, when universities will open again, and maybe he can, as he is a student at a German university, he can maybe tell more about it. But I think we might also move to e-learning, to digital learning, and things like this. It might also happen, also in schools. I mean, the schools are closed in Germany, and the kids are at home. So now the parents are schooling the kids. And there's this phrase homeschooling now. So where parents try to become teachers and try to teach their kids, which is sometimes working very well, but I can also imagine that not always.
Okay. Okay. Thank you so much, Daniel. Okay, so we're running out of time right now, but yeah, let's move on to the next question quickly. Okay, I see hand raising from Wichita again. So yeah, you may go ahead and ask question, Wichita.
Hi. So regarding the global recession and as well as Germany's economic recession, my question is that judging by the EU economic strength before the corona hits, do you think the EU economy will recover faster after everything is okay again? If the second wave of corona doesn't hit, do you think the economy of EU will recover quite fast?
That is a tough question. I don't know. It's too early to predict because we don't know how it will end. So I don't know if the economy will recover fast or not. A lot depends on the overall situation. A lot depends on the number of cases. A lot depends on if there's a vaccine, if there are measures that can prevent the spread. I don't know, but you also have to see in general that even if you have very good healthcare systems, they have to be paid. And if the economy is not running and the state is not collecting any taxes, that will lead to another complicated situation. So you need a very balanced approach. And this lockdown, it's something short term. It's something really the method of the hammer. And I don't know how, what will come. First, we have to look into countries where they stop these very hard measures. I just got the news from Austria, and they will probably be a bit more relaxed after April 14. And so we have to observe what countries are doing. At the moment, what I see is that a lot of countries are copying each other. Some countries started with the lockdown and everybody copied it. But I believe that you need decentralized, very local approaches at the end, coordinated on a higher level. But if, for example, you are in a region, in a village where there are not many cases, what's the sense of closing schools? What's the sense of closing shops if there are no corona cases in your village? So that's what I mean. And I think we have to observe this carefully in the next weeks. And yeah, and then we can talk about the economy. But I think it's a bit too early at the moment.
Thank you, Daniel. So,
can I share a few slides, my last slides about the, let's say, the public opinion, how they see it?
Of course, you may share.
Okay, then I try to do it quick, and I try to share this to you. So you see, sorry for German, for this being in German. So the general situation in Germany that we have a lot of political opinion polls. Basically, every week somebody's asking the population what do they think about the government, about effects, and so on. You see a lot of different effects. here you see the rating of the political parties in Germany. On the and at the moment, the two parties on the left, the CDU, CSU, and the SPD, they are governing the party anymore. They are governing the country at the moment. And for the CDU, CSU, they gained 7% in public opinion and public support in the last week, which is a very, very strong number. And you see that, let's say, you see that the population is quite happy how the government is handling this crisis. They also asked some psychological question. Here is the current situation weighs heavily on me. 52% say no, it doesn't. 48% say yes. So the population is, they are struggling with the situation. Then we have a question on the personal financial situation. The 6% on the left, they say they think they have a very, very high financial impact. 18% say it's high, but the overall majority think that they will have any personal financial problems because of the corona crisis. Then the question, are people afraid of getting the virus? Do they see a risk to their personal health? And you see that 3 weeks ago, this is what you see on the right side, 78% said, no, we are not afraid of getting the virus. And now the majority says they are afraid of getting the virus. So the situation changed a lot in just 3 weeks. People are much more afraid about their personal health, and they are not so relaxed anymore. Here's the question of how, the question is the government handling the crisis good? And you see 89% say yes, the government is handling the crisis all right. And you see it, even the supporter of different parties agree to the measures of the government. So you see a strong unity in this at the moment. And here the question is, they ask what the government, what the population thinks about these heavy restrictions to the daily life. And just 4%, that's the blue color, say it's too heavy, it's too much. 75% say it's all right, and 20% they ask for heavier restrictions, which I think is very interesting because for me, from my perspective, these restrictions are already super heavy, but 20% of the population, they want more. Okay, that's it from my side from this.
Okay, thank you so much, Daniel. So we have less than 10 minutes more, but we're still receiving more questions. Okay, so I would like to give a chance to May. You want to ask question again? So May.
Okay, so thank you. I think Bunawan raised a hand before me, so I would like to give the floor to him, and then if we still have time, I can ask the question later.
Okay, thank you. That's very nice of you. So Buna, please ask your question.
Okay, thank you so much. Today I want to ask a question, but it's a bit out of topic, but otherwise related to the COVID. So from political point of view, in this difficult time, actually we have observed that China try to split it soft power to European by providing medical health, for example, mass or use mass diplomacy in order to split their soft power in Europe and globally. So I want to know that what are the European perspective toward China in this difficult situation? Thank you.
Okay. Thank you so much. Daniel, did you get the question?
Not really.
So then I may have to ask him to restate his question.
Maybe Buna, can you write it in the chat because your microphone is not really working well. Can you please ask the question in the chat and I try to answer it later?
Okay, so please write your question in the chat. Okay, then while he write a question, then I will give a chance to May to ask question.
Okay, thank you. So I would like to ask a question regarding global cooperation of Germany. Has Germany collaborated with the world to address the coronavirus? For example, collaborate to produce vaccination, share budget for developing countries to cope with the pandemic.
Yeah, they are. I mean, it's a bit connected what I said first. At the beginning, every country was looking at itself. I mean, it was more or less the same as you see in ASEAN. Countries are closing borders, think about themselves, try to protect their own population. So at the moment, Germany is a very strong supporter of multilateralism, and of course, there goes a lot of money also into global approaches. I just read the news that Germany is donating a lot of money to the Pasteur Institute in Cambodia to provide better research. I think all the research centers, those who are working on a vaccine, they are interconnected. There is a lot of exchange between the virologists and all this. What we also see on a smaller scale is that from the heavily affected regions in France and Spain and in Italy, our military is flying over there and take patients to Germany, into the hospitals, those who need intensive care. And so this is now going to start. A lot of countries are now trying to help each other, even with this intensive care beds and the ventilators. But yeah, I don't know. Let's see how it works in the future. Yeah, but I mean, it's called a pandemic because it's globally active, and I think we will see the consequences much worse in developing countries, those countries who don't have a proper health system, those countries who don't have a proper social protection system. It will be much more complicated for them. And when the crisis in Europe is under control, of course, we have a responsibility to protect, and we have the responsibility to help others. But this is also the case for other countries. I mean, when we look at the situation, how it started and where it started, yes, at a certain point, China did a very good job in working together with the World Health Organization, but it all could have been avoided when they would have listened to their specialist in Wuhan, who told to the government before, very early, that there is a new virus approaching, but nobody was listening to them. And they even were told by the police to shut up. And we would be in a completely different situation if there were freedom of expression in China. So.
Okay, thank you so much, Daniel. I hope the speaker did answer your question so far. Because we're running out of time, I would like to take the last two questions, and then we will fortunately have to end the discussion here. So question from Yang Moni Udom, he wants to know, the country in EU work on this corona issue independently, or are there also some collaborative measures? Can you elaborate on that?
Yeah, the EU is taking now control, and they are now leading the political measures on the level of the specialists, of the virologists, the experts who are handling this. There is already a lot of coordination, and they all try to work together. They work on different the development of the vaccine, on a lot of different research topics. So I think there is already a lot of coordination, and this is something that you might not observe in the media and the overall public, because this is not really sexy to report. But those things are going on. I'm I'm a big fan of podcasts, and there is one very good podcast from one virologist who is the main virologist in one of the most famous hospitals in Germany, the Charité in Berlin. And when he talks about the virus, I think now whole Germany is listening to him because he's so reasonable and he's explaining it so well that, and from him, I know that there is a lot of coordination and there is a lot of research done at the moment.
Okay, thank you. Last question then from Bonna at the moment. He wanted to ask, politically, during this difficult time, China tried to spread its soft power in EU particularly, and and globally, generally by providing medical help. So what are the European perspective toward China in this time of crisis?
Yeah, I mean, of course, we appreciate the help of China, and we also appreciate that countries are working together. But what we don't like is that when some governments are trying to tell a different story about the virus, where it came from, and if governments are starting to play politics with a health disaster, with the health virus. And I think that's very dangerous. And you see it in a lot of different countries. You have seen it in the US, you see it now in China, that the leaders play politics with the virus. And I personally don't like this situation. I think we all have a responsibility, and we should all help each other. But we should not play politics with the virus.
Okay, thank you so much, Dr. Schmücking. It was our last question that we took here because it's already 6, and even though we have more questions, but I'll be afraid we will end the discussion here. Okay, so would like to thank all of you, the participants who attend this online conference, and would like to also apologize for any inconvenience, and for those who have asked, but then we haven't, because of the time, we haven't got given you a chance to ask, but we can also given you any more update regarding these kinds of issue. We just follow our page and Facebook, and also we also made some video regarding the coronavirus. Just check out our KAS Cambodia YouTube channel, so you can follow us what we are doing with that kind of issue. So we would like also to thank Dr. Schmücking, who take this chance while he's in his home in Germany, host this kinds of meeting, so that we can all to bring us closer to Germany and as well as to Europe. So I guess this is it for the discussion, and thank you so much, all the participants here.
Yeah, thank you also from my side. It was really interesting to talk to you and listen to your questions. You know, I'm not an expert, I'm not a virologist, that's the most important thing. So excuse me if I could not answer everything, but I tried my best.
Okay, so final things is I wish you everyone here healthy, and please don't forget to wash your hands frequently and stay home as much as you can. Bye bye.
Bye bye. Thank you.